Hello and welcome, Mr. Blaine and my fellow students. My name is Emma Brower and I'm a nursing student, and I'm going to be talking to you about the concept of magnet hospitals. So magnet hospitals are a relatively newer trend. There's only about 100 of them across the country. And magnet status just means that they are accredited and recognized by the American Nurses Credentialing Center, which is a branch of the ANA, the American Nurses Association. The healthcare industry is obviously continuously growing. The population is increasing, and therefore the demand of healthcare workers is continuously increasing. And hospitals that are magnet status attract the most amount of new employees per year. And it's improving the quality of healthcare one hospital at a time. So there's many benefits to magnet status hospitals, and I'm going to be talking to you about three of them. The first one I chose is that they attract the most amount of new employees. A big reason for this is that the burnout rate amongst their staff is significantly less than that of non-magnet status hospitals. Burnout pretty much just means that people are not satisfied with their job, or they're not really feeling fulfilled with their job anymore. And this can be a result of being overworked, not having enough time off, or being short-staffed. And a big reason for magnet hospitals having lower burnout is because their nurses are assigned a significantly lower rate of patients. So they have a lower patient to nurse ratio. So people who work at magnet hospitals will have less patients per shift than nurses who work at non-magnet status hospitals. Another reason nurses are attracted to magnet hospitals is the educational requirements. They're pushed and motivated so that they must complete a higher level of education than just their associate's degree. So as an RN, you have a 2-year degree, and you usually have to sign a contract when you're hired that says, I will obtain my bachelor's degree in a certain amount of time. And the idea behind that is that they want their nurses and all of their staff to have the highest level of education in order to provide the best quality of patient care. And a lot of times, because they require you to, they'll offer benefits such as tuition reimbursement to pay for either a portion or your tuition in its entirety. And I put at the bottom here, magnet hospitals prioritize RN education, best practices, collaboration, quality care, and safety. And I got that from the ANCC website itself, excuse me. Another benefit of magnet status hospitals is the better quality of patient care. So they have a lower nosocomial infection rate. Nosocomial infections are infections that a patient obtains while in a healthcare facility that they didn't have upon entry. So pretty much if a healthcare worker doesn't know they have a sickness or a disease, or if they touch a surface in a healthcare facility that's contaminated, and then they get MRSA or they get pneumonia or whatever it is that's acquired by the facility itself. So in magnet status hospitals, these are a lot less significant. And they also have lower mortality rates. The nurses are more alert to their patients, they have less patients to look after, so they have a better understanding of their surroundings. And they also have more time to grow a rapport with their patients. They have more one-on-one time and more time to get to know them personally than super overworked nurses who have a million patients at another hospital. And then with that being said, another benefit is that they have less pharmaceuticals prescribed to their patients and less diagnostic testing. A lot of times in standard hospitals, if somebody is in pain, it's not very hard to get them a pain medication. All they have to do is call the doctor and say, hey, so-and-so is in pain, and they're prescribed a pain medicine, and a lot of times it can get messy and out of hand, and they can become addicted if it's a stronger drug. But with magnet hospitals, you have less patients, so you have more time for therapeutic approaches and more time to really understand the quality of pain and the intensity of pain, and not just go with the easy way out and prescribe them a bunch of unnecessary pain medications. And then with diagnostic testing, you have a higher education and you have a better background, so you can rule out some unnecessary diagnostic testing, excuse me, and just narrow it down to a few diagnoses instead of having to do a whole course of tests that the patient really doesn't need. And then one last benefit is improved communication and management. The nurses are empowered at magnet hospitals, and this is because they're required to be on voting boards to advocate for their preferences of environment and decide really what kind of work environment they want to work in. And they also have increased participation in research. There's mandatory interdepartment meetings so that each floor and each different department within the hospital is communicating and it's not just one-on-one. And the staff is evaluated by the state, by the ANCC, and then they also evaluate themselves, which helps them improve. So in conclusion, these were just a few of the many benefits of magnet status hospitals. Magnet status hospitals are mutually beneficial to the patients, to the staff, and to the hospital and their finances themselves. The best example I can think of is Bay Health Hospital in Milford and now Dover. They just recently became magnet status, I believe, in the last couple of years, and they offer tuition reimbursement, which is really important to me when I'm going to be applying for jobs next year. And it is predicted that more and more hospitals will become magnet status per year across the United States because of the many benefits and the growing prevalence. Thank you for your time, and here are my references.